Corda. Minister, like the previous speaker, I welcome, first of all, your leadership in the area of mental health. I know it's something you understand, something which you've championed, and something which you have made change on within the department. And I certainly, when you look at the figure of €1.1 billion, you think that it's a huge amount of money, but it's also a huge challenge. It's a huge problem. And certainly, Minister, there's a commitment in the programme for government that we would have a director of mental health within the HSE. €1 billion deserves its own director. €1 billion deserves somebody with clinical and administrative responsibilities. And I believe not only would they be a champion along with you on the issue of mental health, but they would also be in the delivery of services. I think for too long we've relied on charities. We've relied on voluntary groups. And we need to get back in the business of mental health being really core to the primary care services that we deliver. And both Minister Feehan behind you and yourself, I suppose in some ways represent the spectrum that's there. And the spectrum is for everything from wellness to really acute mental health. And while we've lifted the stigma on mental resilience, I'm not sure we've lifted the stigma on real acute mental illness. We have a long way to go. I welcome the €1 million community fund, Minister. There will be plenty of groups in my area like the Finglas Suicide Network and the Finglas Wellness Network and groups in Ballymun applying for that. But I do think there's two areas we need to look at. The school inclusion model in education is bringing therapies into our schools. I think we need to think about how we fit mental health into that. And the second one is our ambulance services. 24-hour access to support for mental health is needed. That's provided in the mainstream health service through our ambulance services. They're the key link. I think if you go to Dublin Fire Brigade and the National Ambulance Service, they have a role that they could play in being a bridge to accessing mental health services. And I thank you, Minister, for the work that you've done.